Hi, I'm Jackie, and this is my presentation for LUT1 at WGU, and I'm going to talk about wrong site surgeries. Have you or someone you know ever been the victim of a wrong site surgery? I found through much research on the topic of wrong site surgeries that they actually have a relatively low number of incidences at approximately 1 in every 113,000 surgical cases. Although they are considered a rare event in healthcare, they are also seen as 100% preventable errors because the root cause of 80% of all wrong site surgeries from 1995 to 2005 were a breakdown in communication. This prompted JCO, the Joint Commission on Accreditation for Healthcare Organizations, to create a preoperative verification process called Universal Protocol in 2004. The proper utilization of Universal Protocol will decrease communication breakdown among surgical team members and prevent wrong site surgeries. In this presentation, I'm going to discuss two important points: the preoperative verification process and how to conduct a proper timeout in the operating room. Experts say that verification of the correct person, surgical procedure, and surgical site is performed multiple times prior to the patient entering the operating room, and that the initiation of the surgical site verification process occurs when the surgical procedure is scheduled. Any breakdown in communication at this point should be caught well in advance before the surgery date. Surgical site verification is again performed during the preoperative phone interview with the patient, at the time of patient entry into the facility, and finally before the patient is transferred to the operating room. During these separate conversations with the patient, multiple nurses will ask the patient what procedure they're having performed, and if a conflict or question arises at this point, the surgeon will be contacted. Patients are required to be involved in their surgical site verification or have a family member act on their behalf if applicable. This is another step to ensure that the patient and the family know the exact procedure to be performed. Universal protocols require surgeons to preoperatively mark the surgical site. My first visual aid reflects the two most important steps in the preoperative surgical site verification process. The information was obtained from an article written in 2009 by Deborah Malloy and Rhonda Hughes at the Agency for Healthcare Research and Quality. The first step is when the patient and the doctor discuss on a planned procedure while the patient is still in the preoperative area, and the surgical site should be marked while the patient is awake and alert and prior to moving the patient to the operating room. This ensures that the patient is fully involved and understands the procedure to be performed. The doctor should never mark the surgical site with an X. He is required to put either his initials or the word yes at the planned incision site. The doctor should also use a permanent marker to decrease the chance of the markings rubbing off in the operating room when the site is prepped. Now, this information is critical because these steps are the first line of defense, so to speak, for the patients, and they're equally important because they're part of a larger system of checks and balances. If these small but relevant details are improperly done or forgotten, it puts the patient at greater risk for wrong site surgery due to miscommunication among surgical team members. Further research shows that a final surgical site verification must be performed in the operating room prior to the surgeon making an incision. This process is called a timeout, and it's a time of interactive communication between surgical team members. My next slide shows the steps for a proper timeout. The person performing the timeout should first ensure that all the members of the team are present in the room, including the surgeon, and that he or she has their attention. This timeout period involves focused and active communication between the surgical team members. Proper timeout verification includes the patient's name, surgical site and side, any medication allergies, and it also verifies any implants or special equipment needed is available and that the patient is positioned properly for the procedure. The information on this slide is extremely important because it's the final piece of a system of checks and verifications since the point of initial contact with the patient. This is the last verification for complete correctness of the surgery, and there is no further verification after this point. All surgical team members must agree on all of this information given during the timeout or the process stops and no surgery is performed. Once everyone agrees with the information, the surgery will begin. In conclusion, the research that I have collected reflects that incidences of wrong site surgeries are relatively low. However, when they do happen, it becomes a traumatic experience for the patients, their families, and the entire surgical team members. In the May 2006 issue of the AORN Journal, stated that communication breakdown was the leading cause of wrong site surgeries, which prompted JCO to initiate a universal protocol in an effort to eliminate this horrific medical error. The two most important items to follow according to this protocol are correct surgical site verifications and proper timeout procedures. In summary, proper use of universal protocols will decrease communication breakdown among the surgical team and prevent any wrong site surgeries. Any questions?
You stated that the surgical site has to be marked with either the doctor's initials or the word yes. Why can't they just mark an X on the spot they plan to make their incision?
JCO's universal protocols require the doctors to either use their initials or the word yes, because if they mark the surgical site with an X, it leaves the possibility open that the surgical site, it might not be the correct surgical site or the correct surgical side, and leaving that kind of confusion open leaves the patient open for a possible wrong site surgery.
Have the incidences of wrong site surgeries decreased since JCO started the universal protocol procedure?
Currently, unfortunately, wrong site surgeries are still the most commonly reported medical error despite the efforts of JCO and the AORN. According to AORN Connections 2010 newsletter, there were 18 reported wrong site surgeries between January and March 2010. These numbers reflect the extreme importance of using the patient safety checks and the surgical site verifications. Nurses play a critical role as a patient advocate to ensure the patient safety is top priority.